Welcome to our presentation on the importance of governmental support for palliative hospice education for nursing programs. It is presented to you by Diana Findley, Kathleen Momsen, Sarah Sweat, Anna Walker, and Catherine Whitley. In the introduction, we will state why we need policy change. In the literature review, we will show changes in our society and why the need for palliative education. Our policy options will address current policies, what bills are introduced into Congress today, and what policy we believe should be mandated. Policy Senate Bill 4680. We will present two case studies. In recommendation and analysis, we will present a study, Why Nursing Education is Important. Next steps is the plan for policy change, how nurses can implement these changes. Our conclusions will show that Senate Bill 4260 will provide assistance for hospice palliative care, and that will increase the quality of care for patients. The reference page will be listed at the end. Conversations regarding death, dying, and palliative care are difficult to initiate for most healthcare professionals. There is a negative stigma and fear around dying, having caused many healthcare professionals to feel uncomfortable and unprepared to broach end-of-life conversations with patients. Education and training healthcare professionals on end-of-life and palliative care will make open, honest conversation easier and normalize the dying process. End-of-life conversations should be patient-centered and focus on establishing end-of-life goals with patients and their families. As the need for palliative care education and delivery increase within our nation, we need to find an imperative government leaders that will back Senate Bill 4260 to support palliative care, hospice education for the healthcare professional. In our literature review, we will show how the cultural acceptance of death over time and the need for educating those that are providing the care has changed. Until the late 19th century, the community collaborated together in tending and caring for their dying in their homes. Between 1900 and 1960, death became a fearful, shameful, and taboo subject. But the advancements in medical capabilities prolonged life. For example, mechanical ventilation, IV therapy, and tube feedings changed how we cared for patients. Cultural norm of home death surrounded by families shifted to a death alone inside a hospital or a nursing home. The focus on pain, symptom control, emotional and spiritual needs were not addressed. Until 1960s to the 1900s, the creation of the hospice movement began in this country. The shift in focus on end-of-life care began. There was a push to advocate for meaningful endings with improved quality of life of dying. This increased opportunities for home deaths with symptoms relief and a shorter hospital stay. Despite patients' preferences, their studies reveal high levels of pain for the dying, poor provider communications, and limited access to palliative hospice care. This could be due to, as studies revealed, deficiencies and inconsistencies in end-of-life education for nurses. Studies claim nursing students are not adequately prepared to care for dying patients. This leads to an increase in nursing anxiety and decreases the quality of care for patients. Research demonstrates the need for increased nursing education to prepare nurses to comfortably deliver meaningful end-of-life care for patients. There's two sides of the scale. Loss of human life is never good, and what consists of a good death? Factors that contribute to acceptance are pain management, support of loved ones, personal acceptance, culture, age, personal beliefs, religion, and decision-making. Policy has many holes. The current Medicare Part A is hospice or respite care for those over the age of 65 in a hospital. Medicare Service Investment Account Act of 2019 provides home health for those under age 65 and requiring long-term care. RAISE Family Caregivers Act of 2017. The Department of Health and Human Services provides care for families of children regarding education and home health care. Policies that have been introduced but not passed in previous legislation include expanding access to Palliative Care Act, Palliative Choice and Quality Care Act, Removing Barriers to Person-Centered Care Act of 2019. None of these policies have been passed. The Palliative Care and Hospice Education and Training Act, Senate Bill 4260, is the most comprehensive bill to act as an amendment to the Public Health Service Act. By establishing palliative care and hospice education centers that will improve the training of the interdisciplinary health professionals, disseminate criteria for palliative care, support training of faculty with continued education, and offer clinical training and appropriate sites for students and advanced practice nurses. Authorize grants to train physicians, provide academic career rewards that will promote physicians and individuals of full-time faculty that spend teaching and developing skills in education regarding palliative care. Develop a workforce that offers fellowship programs, supplemental training for pharmacies, social work, and nursing to upgrade their knowledge and skills, as well as enhance teaching skills. Career incentive awards and grants to healthcare professionals who teach and practice palliative medicine, specifically for nursing, and those pursuing doctorates and masters with a focus on palliative care. Offer nurse training in education and nurse retention projects. Develop a palliative care education and awareness of a national campaign to inform patients, families, and healthcare professionals about the benefits of palliative care and their service. And offer research and funds to advance clinical practice and improve care delivery for patients of hospice and palliative care. We have two case studies to present to you. Our first case study is Mr. J from Portland, Oregon, who is a homeless gentleman that lived 15 years in the forest. He came to the hospital for respite care for his severe lung disease, but chose to leave and return to his forest. It was a challenge for his providers to decide if he was mentally capable of making this decision that could impact his end of life. The lesson they learned is have a factual conversation with the patient. They let him make his own decision and supported this patient-centered approach and respected his goals and wishes. Case study number 2 is Mr. D, who was an alcoholic substance abuse user living in a shelter with end-stage liver disease. He was found unresponsive and admitted for hospice service, but upon consciousness, he chose to be a full code. He was moved to the hospital and died shortly afterward. The challenge of him not having advance directives on the file and no one to discuss goals of dying with the patient prior to this point. The lesson they have learned: have those important conversations about disease and end-of-life goals when diagnosed with a terminal illness. This patient should have had a legal document such as an advance directive, and healthcare workers need to respect the patient's wishes and try not to impose their values upon patients. To increase our knowledge to support patient-centered care, studies were analyzed. Bernson et al. 2019 suggests there's significant positive change in nursing students after they have studied palliative care in clinical courses. And in a study by Bush, found that 56% students gained a new perspective on their ability to provide palliative care, being able to discuss bereavement, loss, and grief. And they feel it should be required in nursing education and carry on through all aspects of nursing care. Therefore, we recommend choosing Senate Bill 4260 because without it, it can lead to a deficit in care of palliative care patients and a knowledge deficit in those that care for them. What are our next steps? We believe incorporating the End-of-Life Nursing Education Consortium into undergraduate and nursing school curricula. Position healthcare workers in decision-making and policy revision sites, for example, the healthcare and regulatory boards. We need to pass Senate Bill 4260 that will increase our nursing knowledge. What are our conclusions? As the population age increases, the need for palliative care increases as well. To meet these needs, it's essential to integrate into nursing curricula competencies in the provision of palliative care, and to pass Senate Bill 4260. This will increase our quality of care with each palliative patient to receive training regarding providing symptom management relief, coordinating resources for home, hospital, for families, and opening up communication to help the quality of care improve with each nursing education. Thank you very much. References to follow.